So hello and welcome to our show Awakening on WGSN-DB, the Going Bold and Going Solo Network. The information and opinions expressed here on this show are just that, the opinions of the individual speaking based on their individual personal experiences. They are not intended to diagnose and do not constitute professional advice or recommendations. And I apologize about our dog saying hello. She's deciding that this is her domain at the moment. So my name is Tina Huggins, and I'm your divorce coach specialist and restorative family mediator. And this is Joe Huggins. And our guest speaker today is the lovely Stephanie Berman. She is the founder of AZIZA. Say that for me.
AZIZA.
AZIZA. I asked you for everything but the pronunciation for the project, the AZIZA Project. And we get to find out just what the AZIZA Project is today. A little about Stephanie. So for 13 years, Stephanie suffered with multiple gynecologic pain, and eventually, even through medical, I have this all in here differently, 11 medical practitioners from naturopaths, general practitioners, OBGYN, dermatologists, and physical therapists were unable to provide any answers, much less relief. That all changed when Stephanie met Dr. Corey Babb at the Haven Center in Tulsa, Oklahoma. Not only is Stephanie feeling better than she has for years, but more importantly, she has hope for a full and rewarding life without pain. That's why Stephanie started the AZIZA Project. Stephanie wants to offer other women the same hope by connecting them with medical professionals and funding their travel and procedure expenses. Wow, that just kind of sounds like the project came from the heavens, Stephanie. So welcome. Thank you for joining us today.
Thanks for having me. I'm happy to be here.
And it's like when I go to read from a book, it's like, oh, or paper, it's like, la, 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 la.
Yeah.
So
I'd be doing the same thing.
We normally talk about abuse, but today we're actually kind of talking about the abuse our bodies make us feel from the inside.
Yeah.
And as I was looking over our kind of email chain, I kind of laughed. Joe we hadn't really talked too much about what today was. And so I laughed at the part that we may get to see him embarrassed today.
I doubt it, but try.
Sorry, Joe.
In the process. Okay, so I'm going to set my timer so I pay attention to it. Sometimes I get lost and don't pay attention to it.
No worries.
Okay. So, Stephanie, can you tell us you talk about the fact that you had severe gynecological issues. So, myself as a teenager and just before I had my son, I dealt with severe cramping for my menstrual cycle that would make me, my sister even dealt with it. I talked with her about it this week, actually, that it would make us throw up. We would be in the bathroom for hours. I remember one day I was in there all day long, just throwing up and throwing up. And I had ovarian cysts, and those were extremely painful. You could actually see them through the clothes. Oh. But after my pregnancy, they went away. So tell us about these issues.
Yeah. So as you were telling your story, Tina, I was like, oh yeah, yep. I would say if anybody's experiencing anything like Tina just described, please reach out to the AZIZA Project. We are not in a position to be able to help with endometriosis type stuff yet, but I'm hoping that we'll get there eventually once we get our funding kind of engine going a little bit more. Right now we're focusing on like muscles, nerves, skin issues and hormones are kind of what we're working on right now. We haven't kind of made it up the reproductive tract yet, but we'll get there. So, like Tina mentioned, I'd been suffering with gynecologic pain for 13 years at least. If not going back, if we're including like endometriosis and stuff like that, like what Tina just described, that goes back to high school. You know, I had bad cramps too, not quite that bad, but bad enough by the time I was 35 or 34 that I kind of looked at my husband and I said, hey, if we don't get this taken care of, I'm going to be stuck on the couch for multiple days each month. And he was like, well, then we better get it taken care of. So we were able to thankfully see one of the top endometriosis excision specialists in the country, because she lives just across the state from us, about 4 hours away, in the town where my dad's family is all from. So it was during COVID, we went and we isolated with one of my aunts and uncles for a week, and I had my surgery, and that helped me significantly. You know, getting rid of that monthly pain, I felt a lot better. And then I had some other gynecologic pain issues, more external, that we couldn't diagnose. I'd been suffering with those for, I guess, 9 years at the time. And the nurse practitioner for the surgeon who did my hysterectomy says, well, maybe it's lichen sclerosis. So go talk to a dermatologist when you get home and see if you can get some help. Spent a year on a medication that I really shouldn't have maybe been on. It didn't help at all. Because the dermatologist said, yes, it's lichen sclerosis without doing a biopsy, which is kind of the golden standard for diagnosing lichen sclerosis. And so there I was on this medication, got gaslit by the dermatologist. That was not fun. Yeah, I see you rolling your eyes, Tina. Yeah. The things we go through is just ridiculous. I lost count of the number of times that doctors looked at my husband and said, be gentle, and sent us out the door again. Yeah. Yeah. And then I'm really thankful for the misdiagnosis of lichen sclerosis, though, because it led me to Dr. Babb in Tulsa, Oklahoma. And I live in southeastern Washington state, and I had to travel all the way to Oklahoma to finally get some help. And we're still trying to figure out what's going on. I will say it's not Dr. Babb's fault at all. He's been amazing. He's been anything like the exact opposite of gaslighting. Like, if you can imagine what that feels like, you know, finding a doctor that uses trauma-informed care practices as he's doing procedures is such a breath of fresh air. He has nitrous oxide available in his clinic for even just routine exams if you want it. And so when we've been to Tulsa 3 times to see him now since January 2023. And this third time was my first time getting to try the nitrous out, because we did do a biopsy. He was like, let's do a biopsy this time, because we figured out this is definitely a skin issue. Biopsy comes back atopic dermatitis, which is like so non-specific, it's almost not helpful. So it was nice to know that it's not something scarier, but it's still like, now what? So we're still trying to get to the bottom of that. But he discovered that I had like hypertonic pelvic floor dysfunction, where the muscles in my pelvic floor literally just tighten and they just stay spasmed like all the time. Did you know that you can actually inject Botox into the pelvic floor?
No.
Yes, and it helps the muscles to not spasm. And it lasts for like 3 months. So I've done that 3 times now. Usually, I will throw this disclaimer in for Dr. Babb's sake. He's got this like proprietary way of doing Botox that most of his patients only have to do it once. So the fact that I've had to do it 3 times kind of tells you how bad a shape I was in.
Wow.
So we're really hoping that maybe this time, now that we've got the skin issue sorted out, if we can get rid of that pain so that I'm not clenching from being in pain all the time, maybe we can figure out how to help my pelvic floor a little bit more. So yeah, that's probably way more than your listeners ever wanted to know about my gynecologic health, but there you go. So that's kind of my story. Do you want me to get into like why I started the AZIZA Project and how that all came
We
about?
will. Will. So,
Okay.
so I know from being married. So in my marriage, I dealt with a lot of bladder issues, bladder infection, yeast infections, and we didn't know where it was coming from. Didn't know where it was coming from. After I got divorced and never had it again, I figured out where it was coming from. But it was one of those things that really messed with intimacy. So
Yeah.
I'm assuming that your stuff is really messing with your intimacy.
Absolutely. We went 3 years without any type of intercourse. And that was really hard. But it was actually, again, it was one of those things looking back, it's like that was one of the best things for our relationship too, because it forced us to learn how to communicate and really work on being a team in other ways. So while it was not fun, and my husband is a gem. He's been so supportive, taking care of me, taking care of the dog. I have trouble. We have a 15-pound poodle mix who may start scratching at my door at some point, in which case I'll let him in. You were mentioning your dog earlier, and I'm just kind of giggling to myself because I know my dog is gonna be like, mommy. And so, but he's 15 pounds, but because I've been in pain for so long, I haven't been like exercising or working out like I should. So carrying him to the pet area in front of our condo because it's now 88 degrees outside and the pavement is too hot for him to walk on in bare paws. So my husband has to come home at lunch from his work and take the dog to go so he can go to the restroom. Stuff like that. So, but it's been a challenge, but it's also been really good for our relationship to learn to communicate better. And for me to advocate for myself too, to be able to tell my husband stuff like this, to be able to say, I am not feeling good today. You're going to have to help me out, or be more specific, I'm having this type of pain right now. I just need to go and sit in the bathtub or stuff like that. And thankfully he has been very understanding, and just gentle with me. And I think it's definitely been frustrating at times. We've definitely had our fair share of arguments when he's made a passing comment that he didn't mean to be hurtful, but it's like, you shouldn't be venting to me about having to take care of me. Go vent to somebody else. And so, but I think we've kind of figured that out, and we're actually in a small group with our church right now, who's like, all of the other couples have also been touched by like medical emergencies or chronic pain or stuff like that. So getting outside support is super important as well.
Yes, I have a gentleman that's in Colorado. His name is Jeff Pearson, and he actually runs a program, and I meant to mention this to his oldest daughter, but the program is about the invisible disease that nobody knows that you have, where cancer, everybody can get it,
Yeah.
but when you have this invisible disease, now I mention that because his daughter, the one that we talked about just briefly before we came on, she gave birth to her second daughter, and she has basically one of those invisible diseases. And so I talked with Jeff Pearson here recently about his program, which is very much like yours. So let me hear about the AZIZA Project.
Yeah, I just have to say it's fun that you're mentioning Jeff, because I've been on his program a couple of times now. we did one about the AZIZA Project. We did one about neurodivergence. It's been great.
He's awesome.
So the AZIZA Project started specifically because I found Dr. Babb in Oklahoma. I remember the very first time I had a virtual consultation with Dr. Babb. He can't diagnose, treat, or prescribe during those virtual consultations, but it's a great opportunity to have a conversation with him to see what he might recommend, if you were to travel to Tulsa. And so we had a conversation with him, described everything I'd gone through. He was like, in that conversation, you know, he hadn't had a chance to examine me or anything. He's like, this does not sound like lichen sclerosis. This sounds like a nerve issue. Lo and behold, he was right. And so I'd woken up that morning at 3:30 in the morning, and I was thinking to myself, how can I help other women who are suffering the way I'm suffering, but don't have the financial resources that I do to be able to access this type of care? Because American health insurance will pay more for 4 15-minute appointments than they will for 1 1-hour appointment. But you can't get to the bottom of a complex problem in 15 minutes. So these women end up bouncing from provider to provider to provider, just like I did. Like you said, it's like, I think Dr. Babb was provider number 12 that I saw. And I've heard of women who've seen 20, 30, 40, you know, trying to find answers, and they just can't because they only get 15 minutes. And so doctors like Dr. Babb, who've gone out of network, they don't take insurance, they can spend an hour with their patients, but unfortunately it means they need to charge the patient more. So if you have a woman who's been in so much pain, she hasn't been able to work for so long, then she can't afford to see those doctors unless she has a partner that is working full time and making good money and stuff like this. So I said, how can we do this? Took me 3 months to remember that I had a way to snap my fingers and start a nonprofit. But ironically, I remembered while we were in Tulsa for our very first trip. So I'm laying there on the hotel bed with my phone in my hand, recovering from the anesthesia from that morning's procedure. And I remembered that I had started another project in the women's health sphere more than a decade before that had a fiscal sponsor that I could just reach out to and say, hey, are you interested in another project? And I did. And I met with them a week later, and they said, yeah, we'll take it on, and we'll just see it as an extension of what you're already doing with us. So you don't even have to fill out any more paperwork. I'm like, okay, that sounds great. So there I was. I had technically had nonprofit status because we inherited it from the fiscal sponsor, and I still didn't have a name for the thing. So I went back on my phone and I started Googling. I wanted a word that meant like strength, and I ran across AZIZA, which means beloved, precious, and mighty.
Oh, wow.
And I'm like, it can't get any more perfect than that. So we ran with it, and I just started fundraising between my family and friends. I'm like, I need a logo, I need a branding package, and I need a website. So that was our first kind of foray into that. And then we helped 2 teenage girls last year. We just paid for a consultation for somebody else a couple of weeks ago. So we're working on getting her to Tulsa. This will be the first one we might send to Tulsa. So that's exciting. So yeah. That's a little bit about what we're doing.
Awesome, awesome, awesome. Yeah, I know I run across so many people that can't afford their attorney or things like that. So when you come into this type of arena, yeah, yeah, so much. And when I was dealing with so much of my stuff, I was a teenager, and of course, back then, I'm older than you are, so they didn't believe in menstrual cramps causing one to be sick enough to throw up. But if you talk to several of us, my sister and I specifically, we can tell you that's not a fun event. I mean, we talk about laying there and putting our bellies on the cold cement floors or the tile floor in the bathroom, or hugging up to the toilet just to get that cold feeling on our bellies because it hurt so bad, so bad. And I know, this is a topic that Joe can't interject his information in.
I could say one thing. So you're talking about before the Stone Age.
Thanks.
So I can go one step farther. So I remember my mom saying, after all of us kids were grown and out of the nest, she didn't even know what a hormone was, because you didn't talk about hormones back then. And so she just said, because she'd always stuff it. It'd be like, if you're having a bad day or whatever, or you're aching, you just keep working. That's the old attitude. And I had that attitude for many, many years, not because of female problems, thank God. But just pushing yourself beyond. And I think that's what, it's good to take a break, and it's great to take care of yourself. So to be aware and not ignore. So that's good that people are starting to take that seriously and take care of yourself, because you don't get some special medal for ignoring pain.
Yeah.
There's no badge of honor.
And I think I had to hit that point too of realizing, I don't need to keep pushing myself. And that was like when I found Dr. Bab on Instagram. That's how I found him, was Instagram. When I looked through his profile, I'm like, oh my goodness, he knows so much about so much that can go wrong in the female pelvis. I bet he can figure out what's wrong with me. And like I said, he did. Like, he figured out that one of my issues was an irritated nerve in my pelvis, which happens to run through the pelvic floor, which likely meant, because we knew my pelvic floor muscles were spasmed, they were probably spasming around that nerve and just compressing it and making it angry. Among other issues, of course. But that was kind of the point that I had to get to, was realizing that I was worth, and I am worth, advocating for and fighting for. And yeah, it's really crummy having to spend all this money to travel back and forth to Tulsa for treatment, or to try the next thing. And yet going to Tulsa is like a weight lifts off my shoulders. I told somebody this third trip was almost like coming home, because I knew what I was walking into. I knew what the clinic's like. I knew what Dr. Bab's like. It was just amazing. And then just to feel heard and know that this doctor has taken enough time to learn my case and learn things about me. Like, he knows I'm a dual citizen, so with Canada. So he was, in a recent virtual appointment, he made a crack about a bidet, and he's like, you're from Canada, you know about that. With their connection to Britain and stuff. So just having a doctor that cares that much about what I'm going through and wanting to help, it has been such a relief. And it's also given me the courage to be more vocal and, start speaking up and telling my story. Because I know that I've got somebody I can point people to say, hey, if you're going through the same thing, go talk to Dr. Bab. Because he's so helpful.
Yeah. And this is something that's so important, having Joe here and him listening to this. This is not a topic you hear spoken about in families, no less, outside the door. It's something that's been hush hush, especially in my life. Back when I was a teenager, you don't say anything because you don't want the boys to know,
Yeah.
And I've never been one to keep my mouth shut about stuff. My family could probably tell you that, but it's so important that people know that this kind of stuff happens. I myself deal with hormonal issues. I have since I started my menses cycle, and my hormones got me so out of whack that they had me on this kind of stuff and that kind of stuff for my cycle. They had me on birth control back when I started the cycle, trying to calm things down. Well, we didn't know that it was the birth control's fault, but I started having just weird things happen. And so they took me off the birth control. And as soon as we came off, we realized, oh, I'm having like an allergic reaction. But in fact, what it was anything that messes with my hormones that's not natural to my body doesn't respond. So years later, I had thyroid issues, that is hormonal too. And it's caused some of its issues. They put me on the normal thyroid medicine, and I couldn't take the normal thyroid medicine. So I'm on what's considered half synthetic and half natural, which my body can tolerate and I can deal with. So when you were talking about all of the pain and everything and the fact that Botox worked, I was gonna say this obviously has to do with nerves. And if anybody has dealt with nerve pain down there is worse than general.
Yes, I can definitely relate to that. Yeah, nerve pain down there is painful. Yeah. Let's see. I was gonna say something next, and I don't remember what it was.
Because I talked too long.
It's okay. No, it's not your fault. I'm sure it'll come up. It's gone.
Well, it'll come back.
I do have a question.
Yes.
Can they cauterize the nerve to just deaden it? and be
That
done?
is an option, but it often makes the pain worse in the
Mm.
long run. So that's the trouble with it's called the pudendal nerve. And it's got 3 branches to it. I don't remember what they're called or exactly where they go right now. But it's very still a very emerging science. So you go and you have a nerve block to see if that's really what it is. But sometimes the nerve block works really well. Like my diagnostic nerve block worked amazingly well. I felt the best I'd felt in I had the best 5 days I'd had in more than a decade. And it took care of the pudendal neuralgia pain as far as the pain along the pudendal nerve. It took care of the dermatological issues I was having. And I have an appointment with Dr. Bav on the 21st to say, why did my dermatological pain disappear when we did the nerve block or after my hysterectomy in these very specific circumstances? Because we haven't figured that out yet. And maybe if we figure that out, maybe that'll help us figure out how to get it to go away once and for all. But yeah, so stuff like that, like cauterizing the nerve. There's a water dissection they're doing. All of this is still super experimental because they're just not sure what to do. And those treatments end up being expensive, but then they don't always work either. So the Botox, though, that one's been around long enough that it generally, if the nerve is being pinched by the muscles, then getting the muscles with Botox will generally start to help. It may not be a one treatment fits all. There's also nerve entrapment. It's a question of, is the nerve being squeezed or is the nerve actually stuck with scar tissue and can't move? So there are surgeons out there who actually go in and basically unentrap the nerve, go and take out all of the scar tissue. And there's a gal on Instagram, I don't remember what her handle is off the top of my head, but I've been following her for probably close to 16 months now. And when I started following her, she hadn't had her pudendal neuralgia entrapment surgery yet, but she had it 6 months ago or a year ago, something. It's been a little bit now. And she just posted an Instagram reel of herself doing a cartwheel. She hadn't been able to do a cartwheel in decades. And here she was, she'd been bedridden when I first started following her. She couldn't even walk hardly. And here she is doing a cartwheel. And that's what this pudendal neuralgia unentrapment surgery did for her. So there is hope out there if you're suffering with this type of pain. So yeah.
Yeah. I worked in the natural health remedy arena. And so I understood, I went, my schooling took me through understanding of chiropractic work, understanding of acupuncture, acupressure. And I was also an EMT. And so all of the information that you're giving, when you talk about the nerves down there, and he talked about cauterizing the nerve, those nerves down there are just so intense. You go to mess with them, and if you screw something up, it's possibly screwed up to a point that you can't come back from it.
Yeah.
So I know from the pain that I dealt with as a child that like doing the cartwheels, oh, just you even telling me I can feel that pain come back. I could remember how having all of that stuff, because when you get the endometriosis and you have those cysts that come up, they're big and they entrap the nerve. They pinch those nerves down there. And I would go through, when I would do direct work, I would go through and break scar tissue up as best as I could. And I was able to get not nerves so much, but tendons from being untrapped and muscles from being stuck together, because falling on your bike, I mean, I think all of us have probably done that when we started to ride bikes. That can cause scar tissue.
Yeah. Yeah. So this pudendal neuralgia that I was talking about, one of the risk factors is actually long distance cycling, because you're sitting there and compressing the nerve for so long. And I didn't have that was the confusing part for us, was like, wait, pudendal neuralgia, what's this? You know, Stephanie doesn't have any of the major risk factors. I'm not a cyclist. I haven't had any traumatic births. Stuff like that. And so it's like, where did this come from? But apparently it can just come from the pelvic floor being spasmed around the nerve. And yeah, I don't handle stress very well. So yeah, my pelvic floor is probably a mess. Or obviously we know that now, because I was diagnosed with hypertonic pelvic floor dysfunction. So I will say, we haven't talked about this yet, but pelvic floor physical therapy is a thing. And more women need to know about that. So, and men too, men can do pelvic floor physical therapy. So if you're having, issues, gynecologic issues, even if you've had like endometriosis, you've had excision surgery, or you've had a hysterectomy, go talk to a pelvic floor physical therapist and see what kind of shape your pelvic floor is in, because that could help with incontinence issues and stuff like that. So there's all sorts of stuff that can be done to help gynecologic issues that we're not talking about yet. And so that's part of what I like doing with the AZIZA Project, is, having these conversations. And when Tina told me Joe was going to be here, I'm like, oh, this will be great. I love it when guys get involved, to hear stories. And, oftentimes they'll have a story of their own. They'll be like, oh yeah, my daughter had endometriosis or whatever. And they make that connection, and then they come on as a donor for the AZIZA Project, which is great. I think I remember a story I was gonna tell earlier. I don't remember the context of what you were saying earlier though, Tina, when I thought of this, but my favorite donor, if I'm allowed to have favorite donors for the AZIZA Project, my favorite donor is our 25-year-old single male neighbor.
Oh, awesome.
He's donating because he has sisters.
Right. I
asked him, I'm like, why? He's like, I've got younger sisters. I get it. I'm like, that's awesome.
Yeah. So when we talked earlier about Joe's daughter, the reason is because she gave birth to her first baby, and then there was complications after. What had happened?
So somehow they left some of the placenta inside, and it of course it started going bad.
Rancid.
It was close to her losing her life.
Yeah.
It doesn't take much, but anyways, she didn't want to sue the hospital or anything like that. So she's just like, and she made it a concern there, but she wasn't going to take it to the step, because she had a lot of passion for the people that helped her, and it wasn't intentional, so, but she had her say with them just to hopefully make sure it never happens to anybody else.
Yeah.
But she wasn't in it for the money or anything like that. So she went through a lot of pain. She went through a lot of bleeding. She went back to work, and then she had to quit work because she was just like, something's not right in there. And in hindsight's 2020, but most people don't take it seriously.
Mm-hmm.
She felt the way she felt totally miserable, and I get it. Usually, the old saying is rub some mud on it, get back to work, put duct tape on it or whatever. But that's a serious thing, and in hindsight's 2020, so that, but they got it corrected, and they have two little beautiful baby girls, so.
Yeah, and her
Good.
husband's military, so yeah, rub the mud on it is.
Oh, yeah.
The men
Really.
just, right, men again don't recognize the gynecological pain things,
Yeah.
menses cycles, and oh, it's just normal. It's just, yeah. When it's your body, like you well know, when it's your body, it's not right.
Yeah.
Well, I have 3 daughters, so if they watch this show, they're gonna be like, yeah, Dad, you just went to work when I was in pain, which is more than likely true, because it's just like, it's a bypass thing,
Yeah.
you just, but I'm sure they had a lot of pain through their younger years and stuff.
Well,
Yeah.
ironically enough, I've got a little story I can tell about my dad and I and this whole pain journey that I've been on. Well, both my parents. It's interesting how chronic pain can either divide people or bring people together. And that's what happened when I got when I discovered that, hey, my symptoms were definitely pointing towards endometriosis. And we sat down with my parents and we told them, and we're like, we think Stephanie has endometriosis. Here's our plan. We kind of laid out what we were planning to do about it. And that's when Mom realized, because I've been complaining about painful periods all along, but she's like, oh, just go take a Tylenol, or, go lay down with a hot water bottle, or go take a walk, or drink more water, or whatever it was. So she's trying to be helpful, but she was not being helpful at all. And when I said endometriosis, she realized, oh, because her sister had endometriosis. And they'd seen what that had done to her and her struggles, and it's been bad. And so mom has been a lot more helpful and a lot more understanding of, what's your experience been like, not necessarily asking those exact questions, but being a lot more understanding when I say, I am not feeling well today, I'm just going to go lay on the couch. And now she's not, asking, well, how much water have you drank today, or anything like that, or, go for a walk, or, not making those suggestions anymore, to her credit. And so as we've continued to walk this journey and kind of uncover more of my gynecologic pain generators, it's come around now. My dad, he got diagnosed with prostate cancer a decade and a little bit ago. And they're like, well, you've probably got 5 years and then we'll have to start doing treatment. He made it like the whole decade before they had to go in and do radiation. And then he experienced side effects and complications from that radiation treatment. And he couldn't sit and stuff like this. And I'm like, now you know what I've been dealing with for the last decade. He's like, yeah, I do.
Well, and my male friends that have been through that, one of the biggest things I hear from them is the hot flashes when they go through the chemotherapy for that. And I just laugh. I'm like, oh, this is your karma for going through, thinking that I'm making it up when I'm talking about, you're not old enough to be there yet. But that is also another thing that is just pleasant not to go through.
Yeah. Well, okay, another plug for Dr. Bab here. He is a Menopause Society certified practitioner. So if you're having any menopause issues, again, go follow Dr. Bab. Tina, I don't know if I don't think I gave you his handle, but it's dr.Corey, CoreyBabb on Instagram. Dr. Corey Bab. Go follow him. He's like I said, he knows a ton about female pelvic anatomy and hormones and menopause and stuff like that. So he did a big thing. He's also on TikTok, and he does little TikTok videos and reels on Instagram. And last week he did estrogen, and then he did testosterone, and he's also a little bit of a clown. So he gets on there and he's like on this testosterone video with this pretending to have big muscles and stuff like this. It's just funny. So
yeah, that's good. It makes listening to stuff like that a little bit more simple or pleasant to listen to. So
Yeah.
as we start to wind down here, Stephanie, so tell me how people can either reach you and how they can get help from AZIZA.
Okay. So step one is go to our website, azizaproject.org. And on there, there's buttons that say, hey, schedule a call with Stephanie. We sit down, we have a conversation. I kind of hear your story, and then I have no medical training, but I can kind of tell based on symptoms and stuff, is this something that would be in Dr. Babb's wheelhouse or not? And if I'm not sure, or if I'm absolutely sure, I will send them to, hey, let's get you over to Dr. Babb's clinic, on the phone at least, have them confirm yes or no, and then we go through the whole financial aid process to get that virtual consultation, and then hopefully maybe a trip to Tulsa as well.
Very awesome. Wow. That's why I had to have you on the show. When I talked to you, I'm like, oh, people need to know about the AZIZA. And AZIZA for the AZIZA Project is AZIZA, AZIZA, just like it sounds.
Mm-hmm.
So that was azizaproject.org, correct?
Yes.
Awesome.
And for anyone who has dealt with gynecologic pain and knows how difficult it is to find help, but they're not suffering anymore, I would invite them to come over to our website to sign up for our monthly newsletter and consider making a donation, because this sort of project is expensive. We have operating expenses and project expenses. Sending somebody to Tulsa just for the flights and hotel with their partner, their husband, their friend, whoever's going with them, because we cover both. We don't just say, hey, patient, we'll pay your way, but you have to pay for somebody else to go with you. No, we pay for both, because they need that support person with them. Just going to Tulsa, I think every trip we've paid for, we've gone 3 times now. I think every trip we've done is like at least $1,500 just for the flights and the hotel.
Yeah.
So
obviously donating is huge, and
yes.
any donations are welcome.
Yes,
so
absolutely.
Other than just donating, how could somebody help with donations, like help get donations for you?
Join our newsletter and forward it to people in your network that I have no idea who they are. Tell people about the AZIZA Project, share our stuff on social media if and when I post it, go find stuff on our website and share the links to your social media. We're trying to share patient stories as we can. My whole journey is chronological, like on the website now. And so, yeah, just go read, go share it to LinkedIn, share it to Alignable, share it to Facebook, share it to Instagram, share it to X, I guess it's called now, formerly known as Twitter, and help us get the word out. That's, if you can't afford to donate, that is just as good. That is just as much of a support for us, helping us get the word out, because that will help us find other patients who need our help and other people who can help donate.
Awesome. Well, I appreciate that. So, I'm a certified divorce coach, meaning that I'm trained in the complexities of divorce, and I specialize in the high conflict divorce arena. And my specialty encompasses the abuse from toxic narcissistic people. And Joe himself has experienced abuse from toxic narcissistic people. And so if you're wanting to reach either of us, you can reach us on my website or my email, and that's my website is divorcecoachspecialist.com. My email is Coach Tina Lynn, CoachTinaLynn @gmail.com. And you can find me on social media, and in Facebook, I'm under Tina Lynn Huggins, Huggins. And you can find me on, I think it's Tina Huggins on LinkedIn and Alignable. And I think it's Coach Tina or Coach Tina Lynn on TikTok and whatever the other one's called. I'm not on X. And if you've liked this, if you like this, please comment and share this information with others across all of the Facebook, LinkedIn, just like Stephanie had said. And I want to thank you very much for sharing your story and all the information. And thank you, Joe, for playing a
I
good
tried.
game today.
I do have a recommendation.
Yes.
Okay, so yeah, here it is. Don't problem fix your wife's symptoms. Be all ears, sympathetic, dote on her. Don't fix her. She'll gouge your eyes out.
But also remember, speaking to the husband and the partners of the people in pain for just a second, don't forget to get support for yourself.
Yep.
Ask for help. If you're exhausted, make sure you have a plan for if you're at work all day and you come home and you're supposed to make dinner and you're too exhausted to cook, make sure you have a plan, whether that's, knowing already that you've got food in the freezer that you can pull out last minute, or getting takeout, or stopping on the way home to get takeout. That's cheaper than DoorDash, I will tell you that. And or calling a friend and saying, hey, can you bring us dinner, or DoorDash us dinner or something? Ask for support.
Right.
Amen. Amen. So again, I appreciate you and I appreciate Joe for playing the game with us. So thank you very much, Stephanie, for the information.
Nice to meet you.
Nice to meet you too. Thanks for having me.
Yes, thank you.